Initial first aid provided by the school gym teacher. The injured individual is assisted to a comfortable seated position. The person assessing the ankle removes any barriers to the ankle to get a better look at the injury. Following review of the injury, ice is applied to reduce swelling. The ankle is then wrapped with a tensor for compression. The individual of assistance assesses the mobility of the ankle to determine the degree of injury. Once compressed, the ankle is elevated and iced. The student's parents are reached to inform them of the injury. It is recommended that the student has their ankle reviewed by a professional. Miranda meets with the doctor. Miranda describes her symptoms as intense pain, swelling, bruising, difficulty walking caused by instability, and pain. The doctor does several exams prior to ordering x-rays. The doctor will press on and move the foot around, and the normal foot may be x-rayed for comparison. The doctor explains that the most common ankle sprain is of the lateral or outside part of the ankle. A lateral ankle sprain happens when the foot rolls inwards, stretching the lateral ligaments. Often this happens when a basketball player lands on another player's shoe or someone steps on uneven ground. It is important to treat all structures. There might be damage to several types of structures after an ankle sprain, especially the connective tissues, tendons, muscles, and nerves. Ligaments such as the anterior talofibular ligament, the callanchiofibular ligament, and the posterior talofibular ligament are affected. The peroneal tendon is affected, and muscles such as peroneus brevis muscle and the peroneus longus muscle are affected. The doctor determines the injury as a grade 2 sprain. The injured person may experience considerable difficulty when walking and could be in severe pain. There may be swelling and some degree of bruising. There is a moderate amount of tearing of the ligaments. To use the tissue analogy, there will be significant amounts of tears in the tissue. The ankle will become somewhat unstable. This instability is evident on stress testing, with increased anterior motion showing on the anterior drawer test and indicating an ATFL tear. The doctor recommends RICE for treatment. Rest, your doctor may instruct you to use crutches until walking is no longer painful. Ice, your doctor may ask you to apply ice for 10 minutes a few times a day. You can use an ice pack, a bag of frozen peas, rub the ice from a frozen Dixie cup on painful swollen areas. Compression/support, your doctor may provide you with an AOS brace, which will compress the ankle and provide support to protect healing injured ligaments. Elevation, after the injury, your doctor may ask you to elevate your ankle to reduce the swelling. Tear first piece of tape, keeping it in an eye strip. Tear the anchor point. Start on the inside of the ankle, underneath the foot. With full tension, pull up along outside of the lateral part of the ankle and no tension on the anchor point. Friction helps heat for the adhesive to stick. For the next piece, you tear the anchor, place tape hanging off of heel, peel paper adding 50% tension around heel and wrap around foot underneath arch. Lay the last piece as anchor, no tension. The final piece is a mirror image on the opposite side of the foot. KT tape is used as a flexible support to the ankle. It does not immobilize the joint, but provides support and pain relief for grade 1 sprains. Unlike traditional ankle braces, KT tape provides a light support that is very comfortable and allows you to have a greater range of motion. KT tape can be used as part of the recovery process for more serious sprains, but only after the ankle has recovered enough that it can have some movement without aggravating the sprain. Exercise rehabilitation for ankle sprains. When prescribing ankle exercises, we must take into consideration the multiple structures that are involved in performing and coordinating ankle motion. To attain a full resolution from an inversion sprain, we must be sure to consider multiple muscles and complex fascial layers, all of which work together across numerous joints. To do this, we must be sure to address two essential components: strength and flexibility.